Welcome to the Tech Talks Daily Podcast, where you can learn and be inspired by real-world examples of how technology is transforming businesses and reshaping industries in a language everyone can understand. Here is your host, Neil C. Hughes.
Welcome back to the Tech Talks Daily Podcast. Now, over here in the UK, getting an appointment with your local doctor has been somewhat problematic over the last 12 months because, like most places, I would imagine, due to social distancing, you could no longer see a doctor face to face. So the process begins with calling a reception at bang on 8 o'clock in the morning. Not a minute before, not a minute afterwards. You get a recorded message, 1 minute afterwards, permanently engaged. So bang on 8 o'clock, you have to ring and try to be one of those first lucky people to grab a telephone call back from your doctor. And although technology and telehealth has promised so much, I cannot help but think that when you're ill and you need to speak with a doctor, it shouldn't be like trying to secure front row Beyonce tickets with you rushing in like it's an on sale at 8 a.m. in the morning. And I feel there's so much improvement in this area, and I'm convinced that technology holds the key. And as patients, I think we too could also shift from that reactive approach to our health, where we wait for something to go wrong and then ask the doctor to try and work out what's caused it, and move towards a more proactive approach, where we monitor our own health all the time. And there's so many things now, such as smartwatches that can have an ECG strapped to your wrist, and weight, blood pressure, calorie intake, exercise. We all have so much data about ourselves. But I know that's just the boring IT guy in me, getting all analytical and wanting to find patterns in everything. So today I've invited Jonathan Baktari from E7 Health onto the show. And I want to learn more about how he built a tech company in the healthcare industry, the importance of preventative health and fast, accurate medical testing in this world where a global pandemic has become the norm. And speaking of that, what does the future look like long term? So Dr. Jonathan Baktari is a healthcare CEO, a vaccine and COVID-19 expert, and a physician with specialities in internal, pulmonary, and critical care medicine. And his company, E7 Health, was named the best tech company in healthcare in 2019. And he and his team at E7 specialise in preventative medicine, vaccinations, and testing for viruses. But I don't want to reveal too much now, so buckle up and hold on tight so I can beam your ears all the way to Las Vegas so we can speak with Jonathan right now. So a massive warm welcome to the show. Can you tell the listeners a little about who you are and what you do?
Yeah, so my name is Dr. Jonathan Baktari. I'm the CEO of E7 Health and U.S. Direct Test Centers, and I'm a physician by trade. I practiced clinical medicine for over 15, 20 years, and then transitioned to administrative medicine and then to entrepreneurship and starting healthcare companies. And well, here we are. I mean, I've journeyed from being just a clinical doctor to being a professor in a medical school, having jobs in insurance companies and hospitals, and eventually starting my own healthcare company.
And can you remember where your love of healthcare and technology came from and what put you on the path that you're on today? Because it feels like there's got to be a story there, right?
Yeah, because I grew up in the generation in healthcare that was initially very resistant to technology. I recall when electronic medical records were being introduced, there was a lot of blowback, especially from physicians, old school physicians that just didn't, like the way things were. But as that finally took hold, there was a lot of conflict in the healthcare about, should things stay the same or should we move along? Now, of course, the jury's already, given in their verdict, but there was a period there that there was a lot of struggle. And I remember, being a technology person just sort of naturally and seeing the resistance to adding technology to healthcare. So I grew up in that sort of generation. And so I always wanted to push to use technology to make lives easier for patients and provide better quality, and then make lives easier for the practitioners as well.
And you have been on an incredible journey in technology. So for people that are hearing about you for the first time, can I ask that you share that story of building a tech company in the healthcare industry and also the lessons that you learned along the way?
Yeah, I think necessity is the mother of invention. So when we started our healthcare company, E7 Health, back about 10 years ago, we tried to use technology off the shelf, right? So we tried to use third-party, electronic medical records, practice management, quality, learning management softwares that were already on the shelf. And what we realized is those third-party softwares couldn't really understand what we were trying to do. So we slowly put together a software development team and technology team just out of necessity, because we really wanted to raise the bar in terms of user experience, patient experience, and having technology, even make sure the quality of the care was better, and preventing errors and preventing even sending the patient or the client in the wrong direction for even a little bit. So we started to think, how can we use technology to proactively catch mistakes and improve the experience? And, first we thought, well, okay, we'll just do a little bit. And we did a little bit, and we're like, no, well, we could do more. And once you opened up, Pandora's door, I mean, it was endless what you could do. And so we got to the point where our technology got so good that, patients almost didn't recognize that they were getting a medical experience. I know, like on our website, we have over 10,000 reviews just in the past 3 years, and almost all of them indirectly are testimony to our technology. They just say great care, people are nice, but really what they're talking about is their experience, and that's our technology speaking.
And I think it's worth highlighting that your company, E7 Health, actually went on to be named the best technology company in the healthcare space back in 2019. So can you tell me more about that moment and what it was that you think that paved the way for that award for you?
Yeah, it was an amazing experience. I know when we were at the ceremonies, there was over like 100 companies vying for that spot, as I believe. But I think it was unique. And I think because there are not that many technology companies that are focused really on improving quality and improving patient experience, partly because, at least in the United States, technology's first master is getting reimbursements. In the United States, the healthcare technology really needs to focus on figuring out ways to comply with government regulations, as well as getting reimbursements from insurance companies. So that's their first goal. And then the secondary and third goal is, patient experience and making the staff or physician experience better. Because it doesn't matter if the staff or physician's experience is wonderful, and it doesn't really matter if the patient experience is wonderful. If you don't get reimbursed from the third-party payer, you're not going to be in business. So traditionally, the software we looked at from other companies were much more focused on that and less focused on the patient experience. When we kind of put that together, I think it was pretty revolutionary. A technology that's not only, but essentially only cares about quality and patient experience and staff experience.
Love that. And here in 2021, E7 Health specialises in preventative medicine, vaccinations and testing for viruses. So I've got to ask, how has the global pandemic impacted you and your work over the last 12 months?
Well, Neil, what was interesting is that we weren't doing primary care or urgent care for the past 10 years. All we have been doing is preventative care, mainly through vaccines and testing for different diseases caused by viruses. So in many ways, we were a COVID-19 company before COVID existed. We're one of the very few people that didn't have to pivot at all for this pandemic, because we were testing for other viruses, doing titers and other testing, and providing every adult vaccine available in the United States prior to the pandemic. So really, when COVID-19 hit, we just sort of added it to our repertoire of the other viruses and vaccines that we work with. It was kind of amazing that that's all we were doing. And part of that has to do with not doing primary care, not doing urgent care, not doing occupational medicine. So if you came to our office and said, my tummy hurts, we wouldn't see you, but of course we'd refer you to a primary care specialist. But we were only interested in doing vaccine related work and preventative health.
And it really feels like that healthcare is on quite a journey at the moment. There's attitudes are shifting because I think we've gone from a reactive approach to healthcare where we wait until something goes wrong and then try and do something about it to a more proactive approach, especially with tech and wearables now that are monitoring things like breathing, blood pressure, ECG, steps. There's just so many vast amounts of data that everyone can have about themselves. But can you tell me more about the importance of preventative measures and fast, accurate medical testing, and maybe provide them with people listening with a few tips on how to stay positive and test negative?
Well, I think one of the things this pandemic taught us is, preparedness and the value of it, right? I think we now know that, for example, having, proper supplies and being ready to put the infrastructure, both financially and politically, in place in case something happens. I think that we already know that that's going to help. So I think this taught us a lesson. We thought we were prepared, but we need to prepare more. And one of the things that we've done at E7 Health, for example, is that we've developed technologies for companies to track their employees' health and healthcare on a company portal where they can actually see which patients have gotten what services they still need, what the results are. So we're making it easier for organizations and companies to be ready and prepare for the next thing by providing company-wide technologies where they can literally see, different locations and the status of people in different locations. Those are big projects that we've rolled out and we're continuing to expand on.
And like you said, a few years ago, you won that Best Technology Company in the Healthcare Space Award. So, but for people listening, can you share how you've leveraged technology and your mission to transform healthcare with technology?
Yeah, well, I think part of it comes from understanding that you can use technology in healthcare in two ways. You can, provide better quality, and, there's no reason why we ever have to, be concerned about human error being a big component of medicine, which it has been for, the last 50, 100 years. We can remove a big portion of that. So one, you can get rid of, sort of human error and the mistakes that happen in healthcare. That's really, really important. Like, for example, our software literally will prevent someone from getting a service if they don't qualify based on something they inputted a year ago. And I can go into detail about that. But so that's number one. And then the next thing is, if the patient, I'm sure you've walked into a doctor's office and they've given you a clipboard with 20 pieces of paper. That really doesn't serve anyone any good. Is there a better way to do that? And also for the doctor or the healthcare provider to be spending, 20 minutes out of a 25-minute visit, inputting stuff into a computer. We think it's better if the majority of that time the doctor or clinician or healthcare provider was talking to you and not inputting stuff into a computer. So leveraging technology in healthcare really has to do with having medicine be what it's supposed to be, which is an interaction between you and the healthcare provider and the back and forth and the developing rapport and understanding. Because at the end of the day, that's what healthcare really is. The healthcare provider has to understand you and what you need, not be sitting at a computer filling out a bunch of stuff that's going to make the insurance company happy. I'm not saying that's not important, but if there was a way we could deal with that in a more efficient manner and remove friction in the system. So most of your visit with your doctor is spent talking to your doctor and vice versa. I don't know if that makes sense, Neil. So we actually use technology to get medicine back to the most primitive stage where you just sat with a doctor. I think back in the probably 40s and 50s, I don't know if the doctors even took notes. They just went to see you and they did whatever they did. Obviously, they didn't have a lot of, things that they can give you back then, but still the visit was the most important thing. And then we've gone away from it and we're trying to get it back to where the visit and the rapport is the most important thing. And we use technology in the background so we can have more of that.
And another subject I wanted to bring up with you today, because here in the UK, there are many heated debates around the need for vaccine passports. And I don't just mean international travel. I mean internally within a nation, when things like going to a concert, going to a pub or a public space. So I'm curious, how do you see this panning out? What do you think the normal will look like long term for the next few years?
First of all, I don't know if people realize that there is one other example of a quote unquote vaccine passport that already exists. I believe there's 30, 40, 50 countries in the world that require you to show a yellow fever vaccine passport before you enter the country. And that's been for decades. So that's already been there. I don't know if people notice it, but if you're traveling to certain parts of Africa, South America, Central America, you need to produce a quote unquote vaccine passport to get into the country. So it's not such a new concept if you think about a yellow fever vaccine passport, which already exists. But getting to your question, I think there's two issues with the vaccine passport. Number one, are we talking about a vaccine passport or proof of vaccination that private industry is going to kind of man, or are we going to let government be in charge of that?
Yeah.
And I think that's the first fork in the road. And if you let government do it, then that sort of raises a whole bunch of questions. I mean, what could go wrong if government took care of something like that, right? I mean, we can only imagine what could go wrong. But so I think there would be some natural resistance. Whether the private sector, does that, and the legality of that is really what remains to be seen, because you could certainly see a concert promoter saying, hey, if you want to come to our concerts, we need a certain proof, and the private sector comes up with an app so you can provide the proof, assuming the legality is good. I think having the private sector man that would be a lot different than if governments get involved, because that forebodes a lot of other potential, issues.
Yeah, and there is so much doom and gloom out there. I mean, that talked about that just for a few seconds. That particular topic is a podcast episode completely on its own, but we won't go down that rabbit hole today. But what is it that makes you optimistic about the future and how technology will make a positive impact in health tech? Because there is a lot of doom and gloom out there, but there's so much to be excited for too, isn't there?
Oh, you have no idea. I mean, let's just take, for example, this mRNA technology with the Pfizer and Moderna vaccine. That technology has been sitting on the shelf for over 10 years. And my sense of it is they were afraid to roll it out because there would be a lot of natural resistance to having, injecting genetic material into your arm and having your body produce a protein from it. I don't know how long that would have taken for that technology to be widely, approved of. But when you put a gun to people's head and said, hey, this is a technology that might get us out of this pandemic, all of a sudden having an mRNA vaccine was okay. So I think the world of mRNA vaccines and mRNA technology is about to explode in ways people can't even imagine, both as vaccines for other things that they were holding off on using, as well as anti-cancer and other healthcare uses. So that is just one little example of technology that has been born out of this pandemic. And then we can move on to all of the sort of, I call it the Zoom effect of the COVID pandemic, which is all these tools to communicate remotely and collaboratively from different parts of the world. So I think those benefits are here to stay. Just like World War II caused, post World War II caused a certain ripple effect. Like, for example, suburbs were born out of World War II in the United States with GIs returning from the war. You get consequences from these great disasters, and I think the COVID disaster will bear those kind of fruits, and a lot of it in technology, especially on the vaccine side, as well as on the technology side that has to do with communications like we're doing right now.
Love that. And for anybody listening that would like to find out more information about the work that you do, or even contact your team if they're left with any questions after listening to our conversation today, what's the best way of doing that?
Yeah, my website is baktarimd.com, BAKTARIMD.com, as well as e7health.com. Those are two great places. And of course, we're on social media, on Twitter, Facebook, LinkedIn. So all those places.
Well, a huge thank you for taking the time to join me on the podcast today. Most of all, for sharing your story and how you built a tech company in the healthcare industry, won awards, and the path that got you where you are today, and also for exploring the importance of preventative health and fast, accurate medical testing and what the future looks like. Thoroughly enjoyed chatting with you. Hope we can do it again. Hopefully when the tech conference scene opens back up, maybe we can meet at a conference in Vegas. But more than anything, just thank you for today.
It's an honor and a pleasure. Thank you, Neil.
And I suspect that so much of what we talked about would have resonated with you all today. And this podcast, though, is not about me or even Jonathan. It's about you, too. I always like to put the microphone in front of everybody listening so you can have a voice on this show, too. I'm curious, what is healthcare like where you are? I've shared with you my story here in the UK and my frustrations. Jonathan has shared his inspirational story and his experiences in Nevada, not to mention building a tech company in the healthcare industry and what we can expect in the future. But I'm genuinely interested in learning more about your experiences and how tech could improve healthcare. So please, I invite you all to email me, techblogwriter@outlook.com. Get me on LinkedIn, Twitter, Instagram at Neil C. Hughes, and my website is techblogwriter.co.uk, but I'm sure you know those off by heart now. And the only other thing to say is we had a huge month in March to this podcast. I know we have a lot of new listeners, and I think there's an additional 30,000 people listened to the podcast in March, which is just phenomenal. And if you are listening to the show for the first time, I just want you all to know you're a part of the show. Send in your feedback, and please remember to rate and review the podcast on wherever you're listening to me today, because it really does help bring more people to our little community. And if me, the guest, and yourself all share ideas and experiences of how tech can change the world and make it a better place, that's got to be a great thing, hasn't it? But enough of me. I am a dreamer, but I'm not the only one. So a big thank you for listening. And until next time, don't be a stranger.
Thank you for listening to the Tech Talks Daily Podcast with Neil C. Hughes. Remember, technology works best when it brings people together.